We're the largest private employer in Arizona. We have more than 50,000 employees. California, Colorado, Nebraska, Nevada, and Wyoming. So again, pretty soon you're going to see us expanding where you'll have that travel benefit and everything else. We just bought Village MD in Colorado, surprisingly. So I wonder if we're going to buy it out here. But yeah, but we're really big in Colorado. We're the fourth largest employer in Colorado. We work a lot with Kaiser in Colorado. So their members are allowed to go to our Banner places and vice versa. So it'll be interesting to see how that moves. Banner started with the Lutheran Health System and the Samaritan Health System. 25 years ago, they formed and merged and made Banner. And so I don't know if the roots came from there because the Lutheran Health System is more in the Midwest. Just some awards that we've won. Banner Hospital is a teaching hospital down there on McDowell and 7th Street. And then we also have the University of Arizona Hospital as well in Tucson. So a couple awards that we've won. Most innovative companies, most trustworthy, and 150 best places to work. Again, another reason is why Banner, because there's some agents out there, and I get it. All they do is look at the plan that has the lowest copays and most dental, and they don't think about anything else, right? So, again, why Banner, right? So we're local. Our customer service is local. You have us to support you. We're agile. We have the fast pass. I can give you 100 stories on this. But one story to tell you guys is that we had a member in Yuma, and they were getting chemotherapy. And it was a kind of chemotherapy that no doctor in Yuma knew how to do. And they didn't even have the chemotherapy in Yuma. So my agent called me, and I called my boss. We called our head doctor, Dr. Clark. He made a couple of calls. Within 24 hours, we found a doctor that was out of network in Yuma to treat the patient. So they were driving to Phoenix 3 days a week to have chemotherapy. Could you imagine that? Being sick and having to drive to get your treatment from Yuma. So we found a doctor willing to treat the patient out of network. We also had the chemotherapy shipped to Yuma. So because we own the hospitals, we own the doctor systems, we can do stuff like that the big guy can't. They might be able to do it. It might take them 2 months to work it out. We make one call to our head doctor. He makes a couple calls and we get it done. I can tell you so many stories that we've done like that to help our members. I'll tell you one other very quick story. One of my agents, those neighborhood sites like for where you live and people post online about things for sale in your neighborhood and that kind of stuff. Well, one of my agents sent me a screenshot. A member wrote on the neighborhood site, Banner denied 2 of my MRIs, complaining about Banner. So she sent it to me. I sent it to my boss. We looked up the member and we found out that, and you guys probably know this, 99% of the time when an MRI or anything's denied, it's because the doctor never got the prior auth. He never sent the prior auth over, or they never sent the clinical information over. So we called over. We found out that it wasn't because we denied the MRI, but the doctor never sent over the clinical information so we could approve it. And if it's not sent, then it expires. And then that's why it was denied. But we were able to call the member, reach out to her. We got the MRI approved. But you'll find 99% of the time when your member's stuff is denied, it's usually because the doctor either never sent the prior auth over, or like I just had one yesterday, I spent hours on the phone fixing, but the doctor sent the prior auth over without the clinical information. So of course it wasn't approved, right? We have to have that clinical information. So anyway, the fast pass, you guys just give us a call and we can maneuver and do some really quick things for your members. One other quick story, I had my agent called me because in Sun City, it's not just Banner, but it's every carrier. There's a shortage, not just in Sun City, but everywhere in Arizona, there's a shortage of primary care docs, especially in Sun City, right? So my member called me, brand new member of Banner. My agent called me. She's like, brand new member can't get in until May. So I called our provider relations and they were able to get them in the next day. So again, just different things like that we can. So if you guys, are you familiar with CenterWell primary care? Okay, so it's only certain FMOs, that's why I asked, participate in this program. But what it is we use CenterWell a lot because there's a shortage of primary care docs in Sun City, so we send them to CenterWell, right? But if you go through CenterWell's training, you can call them. It's like a 20-minute training. If you're enrolling a member that doesn't have a primary care doctor and they want to try out CenterWell, you can go on CenterWell's app. You make the member's first appointment. and then you get paid. I don't know what it is. It depends on your FMO, but it's anywhere from 100 to 150, depending on what FMO you have. So just for sending over a patient to CenterWell, you do have to schedule the first appointment on the app. You get paid. So it's a nice, easy extra money, right? One of my agents told me, I thought this was interesting. She'll even say, I'll meet you. She makes the appointment and then she says, I'll meet you over there for the tour. And she does the tour with her member, which there's a lot. She's new, so she's got the time to do that. But if you have a big book, it's hard to do that. I was going to tell you, HRA. Are you guys, I'm sure you know about HRAs, right? Health risk assessment. You get paid $100 if you do the banner HRA. Now, do you guys use Sunfire Connection? Sunfire, okay. Sunfire, they're more difficult to work with. So we don't have some of the platforms, the HRA will pop up after you do it, but not with Sunfire. So if you enroll somebody with Sunfire, then you could just go to the Banner Broker portal and right on the top of the dashboard, it'll say HRA. You just click on it and then you can complete your HRA and you'll get paid $100. We have no time limit. A lot of carriers might have a 3-day time limit. If you don't get it in 3 days, you know how hard that is in AEP to get those HRAs done, right? So with us, we have no time limit, which is really nice. And as I talked about, we are growing. We were the fastest growing Medicare Advantage for the past 2 years. Now this year, we're taking a slow approach. As you'll see, that happens with every